Hi, I'm Andrew Zelenetz, the Vice Chair of Medicine at Memorial Sloan Kettering Cancer Center and a member of the Lymphoma Service at Memorial Sloan Kettering Cancer Center. The research that we've been looking at is to evaluate the role of FDG PET scanning in the diagnosis of lymphoma. FDG PET scanning has become more important in the management of patients with lymphoma as the results have been incorporated into response criteria for the major disease types of Hodgkin lymphoma and diffuse large B-cell lymphoma. So we undertook a large retrospective review of 1,300 cases of non-Hodgkin and Hodgkin lymphoma to ask the question, what is the range of positivity of FDG PET scans at diagnosis? We confirmed prior data to suggest that in Hodgkin lymphoma and diffuse large B-cell lymphoma that the use of PET scan is an excellent tool and typically shows more sites of disease than we would see with CT scan. In follicular lymphoma, we also see a very high diagnostic yield and again, more sites of disease on FDG PET scan than is typically seen with contrast-enhanced CT scan. Interestingly, when we looked at other histologies, we also saw very high diagnostic yields in mantle cell lymphoma, in T-cell lymphoma, and in marginal zone lymphoma. In small lymphocytic lymphoma, CLL type, what we found was quite surprising, and that is FDG PET scan was quite inferior to contrast-enhanced CT scan, and we recommend that it not be part of the initial evaluation of these patients. One of the other major questions that we had was, what is the role of bone marrow biopsy if FDG PET scan has such a high diagnostic yield? So what we looked at was in follicular lymphoma, Hodgkin lymphoma, and diffuse large B-cell lymphoma, we asked the question, where can we find bone involvement? So we looked at bone marrow biopsy results, we looked at CT scan results, and we looked at FDG PET scan results. In Hodgkin lymphoma, bone marrow biopsy was positive in 13 cases. In only 2 of these cases, however, the PET scan failed to demonstrate disease in the bone. So it's possible that in Hodgkin lymphoma, one could eliminate the need for bone marrow biopsy. However, in diffuse large B-cell lymphoma, the situation was quite different. 13.5% of the patients had a positive bone marrow despite having a negative CT or PET scan for bone disease. And in follicular lymphoma, 35% of patients had a positive bone marrow despite a negative contrast-enhanced CT and FDG PET scan. So therefore, we feel that in non-Hodgkin lymphoma, bone marrow biopsy remains an essential tool for the diagnosis of bone and bone marrow disease, despite the excellent results with FDG PET scanning in the staging of patients with lymphoma.